today's world, it can feel overwhelming to navigate the sea of advice about cancer prevention. Every day, we hear different opinions and recommendations, making it hard to know what really works. With so much conflicting information, it's crucial to focus on strategies that are backed by solid evidence. Understanding what truly helps reduce cancer risk can empower us to make better choices for our health. This text will explore essential lifestyle tips that can play a significant role in lowering the chances of developing cancer. We will look at the importance of a healthy diet, regular exercise, sun protection, and the right medical care. By staying informed about these actionable steps, we can take charge of our long-term health and well-being. Avoiding tobacco is crucial for reducing the risk of cancer, as both smoking and chewing tobacco introduce harmful substances known as carcinogens into the body. These carcinogens can lead to various types of cancer, including lung, mouth, throat, pancreas, and bladder cancer. When tobacco is smoked, the smoke contains thousands of chemicals, many of which are toxic and can damage the DNA in our cells. This damage can lead to the uncontrolled cell growth that characterizes cancer. Chewing tobacco is not safe either. It can cause oral cancers and other serious health issues, as it exposes the mouth and throat to harmful chemicals directly. Secondhand smoke is another significant concern. People who do not smoke but are exposed to smoke from others can also face serious health risks. This exposure can lead to lung cancer and other respiratory problems, making it essential to protect non-smokers, especially children and pregnant women, from tobacco smoke. Quitting tobacco is one of the best decisions a person can make for their health. Healthcare professionals play a vital role in this process. They can provide guidance, support, and resources to help individuals quit. There are also various nicotine replacement therapies available, such as patches, gum, and lozenges, which can help ease withdrawal symptoms. Counseling support can further enhance the chances of successfully quitting by addressing the psychological aspects of addiction. The benefits of quitting tobacco are significant. Not only does it greatly reduce the risk of developing cancer, but it also improves overall health and well-being. Quitting can lead to better lung function, increased energy levels, and a lower risk of heart disease. Additionally, when individuals quit smoking or chewing tobacco, they set a positive example for their family and friends, encouraging others to make healthier choices as well. In summary, avoiding tobacco is essential for reducing cancer risk and improving long-term health. The harmful effects of tobacco, whether through smoking or chewing, are well documented, and the benefits of quitting are profound. With the right support and resources, a healthy diet plays a significant role in cancer prevention. Eating a variety of plant-based foods, such as fruits, vegetables, whole grains, and legumes, provides essential nutrients that our bodies need to function well. These foods are rich in antioxidants, which help protect our cells from damage, and they also contain fiber, which is important for digestive health. Studies suggest that a diet high in these plant-based foods may lower the risk of developing certain types of cancer. On the other hand, it is important to avoid high-calorie, processed foods. These foods often contain unhealthy fats, sugars, and additives that can contribute to weight gain and other health issues. Being overweight or obese is linked to an increased risk of several cancers, including breast, colon, and liver cancer. Limiting alcohol consumption is also crucial, as drinking alcohol has been associated with a higher risk of these cancers as well. Another dietary choice to consider is reducing processed meats. There is a slight association between processed meats and cancer risk, so it is wise to limit their intake. Instead, focusing on healthier options can be beneficial. The Mediterranean diet is a great example of a healthy eating pattern that emphasizes plant-based foods. This diet includes plenty of fruits, vegetables, whole grains, and healthy fats, such as olive oil, while reducing the consumption of red meat. Following the Mediterranean diet can provide numerous health benefits, including a lower risk of cancer, due to its focus on nutritious foods and balanced eating. In summary, a healthy diet rich in plant-based foods, while avoiding processed foods and limiting alcohol, can help lower the risk of cancer. Embracing dietary patterns like the Mediterranean diet can further support overall health and well-being. Maintaining a healthy weight and being physically active are important steps in lowering the risk of cancer. Excess weight can lead to various types of cancer, including breast, lung, colon, and kidney cancer. This happens because extra body fat can cause hormonal imbalances and increase inflammation in the body. Hormones play a significant role in how our cells grow and function, and when they are out of balance, it can lead to the development of cancer. Inflammation, which is the body's response to injury or infection, can also contribute to cancer growth if it becomes chronic. Physical activity is essential not just for managing weight, but also for reducing cancer risk. Regular exercise helps support the immune system, which is crucial for fighting off diseases, including cancer. It also helps regulate hormones, keeping them in balance, and reducing the chances of cancer developing. To gain these benefits, it is recommended to engage in at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous exercise each week. Activities like walking, cycling, running, or even playing sports can be great ways to stay active. In addition to structured exercise, it is important to incorporate physical movement into your daily routine. Simple actions like taking the stairs instead of the elevator, biking to nearby places, or gardening can add up and support long-term health. By making these small changes, you can help maintain a healthy weight and lower your cancer risk over time. Sun protection is essential for maintaining healthy skin and reducing the risk of skin cancer. One of the main dangers comes from ultraviolet rays, which are strongest between 10 a.m. and 4 p.m. During these hours, the sun's rays can cause significant damage to the skin, leading to sunburn and increasing the risk of skin cancer over time. To protect yourself, it is wise to seek shade whenever possible, especially during peak sun hours. Wearing protective clothing can also help shield your skin from harmful rays. Long-sleeve shirts, long pants, and broad-brimmed hats are excellent choices. Additionally, UV-blocking sunglasses are important for protecting your eyes and the sensitive skin around them. Another crucial step in sun protection is the use of sunscreen. It is recommended to apply a broad-spectrum sunscreen with an SPF of at least 30 to all exposed skin. This type of sunscreen protects against both UVA and UVB rays. Remember to reapply it every 2 hours, and more often if you are swimming or sweating, to ensure continuous protection. It is also important to avoid tanning beds and sun lamps. These devices emit harmful UV radiation that can lead to skin damage and increase the risk of skin cancer, just like direct sunlight. By adopting these sun-safe practices, you can enjoy the outdoors while keeping your skin healthy and reducing the risk of skin cancer. Embracing these habits will help you protect your skin for years to come. Vaccinations play a crucial role in preventing certain types of cancer that are caused by viral infections. One of the most important vaccines is the hepatitis B vaccine. This vaccine helps protect against liver cancer by preventing chronic hepatitis B infections. Chronic hepatitis B can lead to serious liver problems, including cancer, so getting vaccinated is a key step in reducing this risk. Certain groups of people are at a higher risk for hepatitis B and should prioritize getting vaccinated. Healthcare workers, for example, are often exposed to blood and bodily fluids, making them more vulnerable to infections. Individuals with multiple sexual partners also face a greater risk, as hepatitis B can be transmitted through sexual contact. Additionally, anyone who might come into contact with infected blood, such as those who use shared needles, should consider vaccination to protect themselves. HPV is linked to several types of cancer, including cervical, throat, and anal cancers. Vaccination against HPV is especially effective when given to preteens, as it helps build immunity before they become sexually active. However, the HPV vaccine is also available for adults up to age 45, making it accessible to a wider range of people who may benefit from it. It is essential for individuals to consult their healthcare providers for personalized vaccination recommendations. Healthcare professionals can help determine which vaccines are appropriate based on personal health history and risk factors. By getting vaccinated, people can take significant steps toward reducing their risk of cancers caused by viral infections. To reduce the risk of cancer, it is important to avoid risky behaviors, especially those that can lead to infections. Practicing safe sex is a key part of this. Infections like HIV and HPV are linked to various types of cancer, so taking steps to protect yourself is crucial. One effective way to lower the risk of these infections is by limiting the number of sexual partners and consistently using condoms. Condoms act as a barrier that can help prevent the spread of sexually transmitted infections, making them an important tool for maintaining sexual health. Another significant risk factor is needle sharing. Sharing needles can transmit serious infections like HIV and hepatitis B and C. These infections can lead to severe health issues, including liver cancer. It is vital to avoid sharing needles, and to seek help if you or someone you know struggles with substance misuse. Medical care and addiction support services can provide the necessary assistance to overcome these challenges and reduce the risk of related health problems. By avoiding these risky behaviors, you not only protect your own health, but also contribute to the well-being of your community. Making informed choices about sexual health and substance use is essential for everyone. Remember, taking these precautions can lead to a healthier life for you and those around you. Regular medical care plays a crucial role in preventing cancer and ensuring early detection of potential health issues. One of the simplest yet most effective ways to stay aware of your health is through self-examinations. By regularly checking for changes in your body, such as unusual skin spots or lumps in your breasts, you can catch abnormalities early. This proactive approach can lead to timely medical advice and intervention, which is essential for better outcomes. In addition to self-examinations, professional cancer screenings are vital for early detection and treatment. These screenings are designed to identify cancer before symptoms appear, making them an important part of healthcare. For instance, mammograms are used to detect breast cancer, colonoscopies help find colon cancer, and Pap smears are essential for identifying cervical cancer. Each of these tests plays a significant role in catching cancer early when it is often more treatable. It is also important to consult with healthcare providers to create a personalized screening schedule. Factors such as age, family history, and individual risk factors can influence when and how often you should be screened. By working with your doctor, you can ensure that you are following the best plan for your health needs. In conclusion, being proactive about medical care is a vital step in protecting your long-term health. Regular checkups, self-examinations, and professional screenings can make a significant difference in catching cancer early and improving treatment outcomes. Taking these steps can help you stay healthy and safeguard your future. Reducing the risk of cancer is something we can all work towards by making simple yet effective lifestyle choices. One of the most important steps is to avoid tobacco in all its forms, as it is a leading cause of many types of cancer. Eating a balanced diet rich in fruits, vegetables, and whole grains can help strengthen our bodies and support our immune systems. Staying active through regular exercise not only helps maintain a healthy weight, but also boosts our overall well-being. Protecting ourselves from harmful UV rays by wearing sunscreen and seeking shade can significantly lower the risk of skin cancer. Additionally, getting vaccinated against certain viruses like HPV and hepatitis B can prevent cancers linked to these infections. It's also crucial to avoid risky behaviors, such as excessive alcohol consumption and unsafe practices, which can increase cancer risk. Finally, undergoing regular medical checkups and screenings allows for early detection and better treatment options. By implementing these strategies, we can take proactive steps toward better health and well-being. I encourage you to think about one change you can make in your life to reduce your cancer risk. Whether it's eating healthier, exercising more, or getting that vaccination, every small step counts. Share your insights with others to inspire them on their journey to better health. Remember to like, share, and subscribe to support continued valuable. Thank you for joining us in exploring the fascinating world of centenarians and the secrets behind their remarkable longevity. It's truly inspiring to see how lifestyle choices can shape our health and happiness as we age. Now that we've delved into the main content, let's shift gears and dive deeper into the essential elements that contribute to a long and fulfilling life. Have you ever looked at centenarians with admiration and curiosity, wondering how they live such long and fulfilling lives? If you're in your 70s or 80s, you are on your way to joining this exclusive club. The journey to optimal health and vibrant living beyond 90 is not just a dream. It's a reality that many are achieving through mindful choices. In this next segment, we'll explore the vital role of nutrition, exercise, and mental health in crafting a lifestyle that not only extends our years, but enriches them. Get ready to uncover practical tips and inspiring stories that will motivate you to embrace a healthier, more active life. Let's embark on this exciting journey together and discover how you can thrive in your golden years. Limiting excessive salt intake is a crucial step in maintaining heart health and preventing high blood pressure. Sodium, a key component of salt, plays an important role in our bodies, but too much of it can lead to serious health issues. When we consume high amounts of sodium, it causes the body to retain water. This water retention increases the volume of blood in our circulatory system, which can raise blood pressure. Over time, high blood pressure or hypertension puts extra strain on the heart, and blood vessels, leading to a higher risk of heart disease and stroke. The risks associated with high sodium intake extend beyond just heart health. Chronic high blood pressure can damage the kidneys, making it harder for them to filter waste from the blood. This can lead to kidney dysfunction, which may require dialysis or even a kidney transplant in severe cases. Additionally, there is growing evidence that high sodium levels may contribute to cognitive decline and increase the risk of conditions like dementia. Experts recommend that most adults limit their sodium intake to no more than 2,300 milligrams per day. However, for individuals with existing health conditions such as hypertension or heart disease, a more stringent limit of 1,500 milligrams per day is often advised. This reduction can significantly lower the risk of developing serious health problems and can help manage existing conditions more effectively. By being mindful of salt intake and making healthier food choices, individuals can take important steps toward better heart health and overall well-being. Simple changes, like cooking at home, reading food labels, and choosing fresh foods over processed ones, can make a big difference. In conclusion, managing sodium intake is essential for maintaining heart health and preventing a range of serious health issues. By following expert recommendations and being aware of the effects of sodium on the body, individuals can protect themselves from the risks associated with high blood pressure and its complications. Obesity is a serious health issue that can lead to many dangerous conditions. When a person is obese, their body has extra weight that puts a lot of strain on the heart. This strain can cause problems like high blood pressure and elevated cholesterol levels. Over time, these issues can lead to the buildup of plaque in the arteries, which increases the risk of heart disease and stroke. Moreover, obesity is closely linked to type 2 diabetes. This condition occurs when the body cannot use insulin properly, leading to high blood sugar levels. Living with diabetes can bring about several complications, including nerve damage, kidney problems, and even vision loss. These complications can significantly affect a person's quality of life and overall health. To combat obesity and its related health risks, it is essential to adopt a balanced diet. Eating a variety of nutrient-dense foods, such as fruits, vegetables, whole grains, and lean proteins, can help manage weight effectively. Additionally, practicing mindful eating habits, like paying attention to hunger cues and avoiding distractions during meals, can support healthier choices and promote overall well-being. By making these changes, individuals can take important steps toward a healthier life and reduce the dangers associated with obesity. Excessive alcohol consumption can lead to a range of serious health issues, particularly affecting the liver. The liver is crucial for processing alcohol, but when too much is consumed, it can become overwhelmed. One common condition that arises from heavy drinking is fatty liver disease, where fat builds up in liver cells. This can happen even in people who do not have a history of heavy drinking. If drinking continues, it can progress to alcoholic hepatitis, which is an inflammation of the liver. This condition can cause symptoms like jaundice, abdominal pain, and fever. The most severe consequence of long-term excessive drinking is cirrhosis, where the liver becomes severely scarred and can no longer function properly. This can lead to liver failure, which is life-threatening. The effects of alcohol are not limited to the liver. Drinking too much can also raise blood pressure, increasing the risk of heart disease and stroke. It can cause digestive issues, such as acid reflux and gastritis, which can make it uncomfortable to eat and digest food. Additionally, alcohol can interfere with the absorption of essential nutrients, leading to deficiencies that can affect overall health. For example, it can reduce the absorption of vitamins like B12 and folate, which are important for energy and brain function. Speaking of brain function, excessive alcohol can impair cognitive abilities, affecting balance, mood, and coordination. This can lead to accidents and injuries, as well as mental health issues like depression and anxiety. The impact on mood can create a cycle where individuals drink more to cope with their feelings, further worsening their health. For those who choose to drink, guidelines suggest moderation up to 1 drink per day for women and up to 2 drinks per day for men. However, some individuals should avoid alcohol altogether. This includes people with certain health conditions, such as liver disease, pancreatitis, or those who are pregnant. Additionally, individuals taking medications that interact negatively with alcohol should also abstain to avoid serious side effects. In summary, while moderate alcohol consumption may be acceptable for some, excessive drinking poses significant risks, especially to liver health. and overall well-being, it is essential to be mindful of these risks. Smoking is one of the most serious health risks people face today, and it is the leading cause of preventable death worldwide. The harmful substances found in cigarettes, such as nicotine, tar, and heavy metals, can cause significant damage to the body. Nicotine is highly addictive, making it hard for smokers to quit. It can increase heart rate and blood pressure, putting extra strain on the heart. Tar, a sticky substance that builds up in the lungs, can lead to chronic respiratory problems and lung diseases like chronic obstructive pulmonary disease. Heavy metals, which are also present in cigarette smoke, can contribute to lung damage and increase the risk of various cancers. Smoking is not just harmful to the lungs, it also raises the risk of cardiovascular diseases. The chemicals in cigarettes can cause the arteries to narrow, leading to heart attacks and strokes. Additionally, smoking is linked to several types of cancer, including lung, throat, mouth, and bladder cancer. The longer a person smokes, the greater their risk of developing these serious health issues. However, quitting smoking can bring about both immediate and long-term benefits. Right after quitting, a person's heart rate and blood pressure begin to drop, and within a few weeks, lung function starts to improve. Over time, the risk of heart disease decreases significantly, and the chances of developing cancer also decline. Many people who quit smoking report feeling better overall, with improved energy levels and a greater sense of well-being. For those looking to quit, there are many resources available. Nicotine replacement therapies, such as patches or gum, can help ease withdrawal symptoms. Support groups and behavioral therapies can provide encouragement and strategies to cope with cravings. Quitting smoking is a challenging journey, but with the right support and tools, it is possible to succeed and enjoy a healthier life. As we age, our bodies undergo many changes that can make strenuous activities riskier. Older adults often face a higher chance of fractures, osteoarthritis, and injuries due to weakened muscles and bones. These risks can lead to serious health issues and a decrease in overall quality of life. Therefore, it is important to be mindful of the types of physical activities we engage in as we grow older. Instead of high-impact exercises that can put stress on the joints and bones, low-impact activities can provide a safer alternative. Walking is one of the simplest and most accessible forms of exercise. It can be done almost anywhere and helps improve cardiovascular health while being gentle on the joints. Swimming is another excellent option, as the water supports the body and reduces the risk of injury while providing a full-body workout. Yoga and Tai Chi are also wonderful choices for older adults. These practices focus on balance, flexibility, and strength, which are crucial for maintaining mobility and preventing falls. They also promote relaxation and mental well-being, helping to reduce stress and anxiety. Light strength training can be beneficial as well, as it helps to build muscle mass and improve bone density, which is essential for overall health as we age. Engaging in these low-impact exercises not only supports physical health, but also enhances mental well-being. Regular activity can boost mood, improve sleep, and increase energy levels. It is important, however, to listen to your body and recognize its limits. If something feels uncomfortable or painful, it is wise to stop and consult a healthcare professional if needed. In summary, while avoiding strenuous activities is crucial for older adults to prevent injuries and health complications, there are many safe and enjoyable alternatives available. By incorporating low-impact exercises like walking, swimming, yoga, Tai Chi, and light strength training into daily routines, older adults can maintain their health, improve flexibility, and enhance their overall quality of life. Remember to prioritize safety and always pay attention to what your body is telling you. Nighttime driving can be particularly challenging for older adults due to several age-related factors. One of the main issues is vision decline, which often makes it harder to see clearly in low light. As people age, their eyes may not adjust to darkness as quickly, making it difficult to spot pedestrians, road signs, or other vehicles. Additionally, glare from oncoming headlights can be blinding, further reducing visibility and increasing the risk of accidents. Older adults may also experience reduced peripheral vision, which means they might not see cars or obstacles approaching from the sides. This combination of factors can significantly heighten the chances of a crash during nighttime driving. To help older adults stay safe, it is important to consider strategies that limit their nighttime driving. One effective approach is to encourage the use of rideshare services, which can provide a safe and convenient way to travel without the stress of driving at night. Public transportation is another great option, as it allows older adults to avoid the challenges of nighttime driving while still getting to their destinations. Additionally, adjusting schedules to finish outings before sunset can greatly enhance safety and comfort. By planning activities during daylight hours, older adults can reduce the risks associated with nighttime driving and enjoy their outings more fully. Overall, by recognizing the challenges of nighttime driving and exploring alternatives, older adults can maintain their independence while prioritizing their safety on the road. Social isolation can have serious effects on both mental and physical health. When people feel alone, they are at a higher risk of developing depression. This feeling of loneliness can lead to sadness and a lack of motivation, making it hard to enjoy life. Over time, being isolated can also affect how our brains work, leading to cognitive decline. This means that thinking, remembering, and learning can become more difficult. The longer someone is isolated, the more they may feel disconnected from others, which can create a cycle of loneliness that is hard to break. To help combat these feelings, it is important to encourage social engagement. One way to do this is by setting up weekly calls with friends or family. A simple phone call can brighten someone's day and remind them that they are not alone. In-person visits can be even more powerful. Spending time together, whether it's sharing a meal or just chatting, can strengthen bonds and create lasting memories. Joining clubs or groups that focus on shared interests can also be a great way to meet new people. Whether it's a book club, a sports team, or a crafting group, being part of a community can provide a sense of belonging. Volunteering is another wonderful option. Helping others not only benefits the community but also allows individuals to connect with like-minded people, fostering friendships and a sense of purpose. Attending community events, such as fairs, concerts, or workshops, can also open doors to new connections. These gatherings provide opportunities to meet new people and engage in fun activities together. The benefits of these meaningful connections are immense. They can lead to improved emotional well-being, a greater sense of belonging, and even better physical health. When we share experiences with others, we create bonds that can lift our spirits and enrich our lives. In summary, taking proactive steps to engage socially can help reduce the risks associated with isolation. By reaching out to others, participating in activities, and building connections, we can enhance our mental and physical health. It's never too late to start fostering these relationships and creating a supportive network. Recognizing and addressing warning signs in our bodies is crucial for maintaining good health. Especially as we age, our bodies often communicate potential health issues through various signals, and being aware of these signs can lead to early intervention and better outcomes. For instance, if someone starts experiencing mobility challenges, such as difficulty walking or climbing stairs, it may indicate underlying problems that need attention. Similarly, balance issues can increase the risk of falls, which can lead to serious injuries. Changes in speech can also be a warning sign. If someone notices that they are having trouble finding the right words or their speech becomes slurred, it is important to seek medical advice. Cognitive alterations, such as forgetfulness or confusion, can be early indicators of conditions like dementia or other neurological issues. These changes should not be ignored, as early diagnosis can make a significant difference in managing such conditions. Emotional health is just as important as physical health. Persistent sadness or feelings of hopelessness can affect overall well-being and may signal depression or anxiety. Addressing these feelings is essential for a fulfilling life, and seeking help from a healthcare provider can lead to effective treatment options. Proactive medical attention is key. Regular screenings can help catch potential health issues before they become serious. It is also important to have open discussions with healthcare providers about any changes in health, no matter how small they may seem. This communication can lead to timely interventions that can improve quality of life. In addition to physical health, emotional and mental well-being plays a significant role in aging gracefully. Taking care of our mental health, staying socially connected, and engaging in activities that bring joy can enhance our overall health as we grow older. By recognizing and addressing warning signs, we can take charge of our health and ensure a better quality of life. Living a long and fulfilling life is something many of us aspire to achieve. To help you on this journey, there are 8 essential tips that emphasize the importance of making healthy lifestyle choices. Managing your health proactively and nurturing strong social connections. First, maintaining a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can significantly impact your overall health. Regular physical activity is also crucial. It keeps your body strong and your mind sharp. In addition to diet and exercise, staying on top of your health through regular checkups and screenings can help catch potential issues early. This proactive approach allows you to take charge of your health and make informed decisions. Equally important is the role of social connections. Building and maintaining relationships with family, friends, and community can provide emotional support and a sense of belonging, which are vital for mental well-being. Moreover, engaging in lifelong learning and pursuing hobbies can keep your mind active and your spirit vibrant. Practicing mindfulness and stress management techniques can also enhance your emotional health, helping you to cope with life's challenges more effectively. Lastly, embracing a positive attitude towards aging can transform your perspective, allowing you to enjoy each stage of life with grace and enthusiasm. As you reflect on these tips, think about how you can incorporate them into your daily routine. Share your thoughts with others, and consider what steps you can take to improve your well-being. The goal is to live vibrantly and independently, embracing aging with positivity. Remember, every small change can lead to a healthier, happier life. Thank you so much for joining us in that deep dive into our main topic. We've explored some fascinating insights, and now it's time to shift gears a bit. Have you ever noticed how certain habits sneak into your life as you age without even realizing it? These subtle changes can significantly impact your relationships, self-image, and overall well-being. As we transition into our next segment, we'll be delving into these behaviors that often go unnoticed, but can shape our lives in profound ways. Understanding and addressing these habits is crucial for enhancing our quality of life and strengthening our connections with loved ones. So, let's embark on this journey together and uncover the hidden patterns that might be influencing us more than we think. Stay tuned, because what's coming next is sure to spark your curiosity. As people age, they often find themselves neglecting their personal appearance without even realizing it. This can start with small things, like skipping a haircut or forgetting to take care of their skin. Over time, these little choices can turn into a habit, leading to a look that feels unkempt. When grooming routines fall by the wayside, it can create a perception of neglect, not just in how others see us, but also in how we see ourselves. Many people begin to prioritize comfort over style, especially as they get older. While comfort is important, this shift can sometimes lead to wearing clothes that are more about ease than looking good. This change can affect self-confidence, making individuals feel less put together and less willing to engage in social situations. When we don't feel good about how we look, it can be hard to connect with others, and we might miss out on opportunities to bond and share experiences. On the other hand, taking the time to maintain a polished appearance can truly revitalize one's sense of self. Simple acts like getting a haircut, caring for our skin, and keeping